Good afternoon. Thanks for joining us here today. There's obviously been a lot of discussion as of yesterday based on what the Republican leadership has decided to do with people making minimum wage up to about probably $8.50 an hour, and they have said loudly and clearly that their health care doesn't necessarily matter and that they will not have access to Badger care through expanded Medicaid here in the state of Wisconsin, which is really, truly too bad. When we went around the state on the Finance Committee hearings, people did not show up to testify against what Governor Evers was proposing on the Medicaid expansion. Everybody who testified on the Medicaid issue was in favor of expanding Medicaid up to 138% of federal poverty level, which again is about $8.50 an hour. I find it very, very ironic when the Republicans say they don't want to put people on welfare, at the same time refusing to raise the minimum wage. These people are stuck. They need help. The Affordable Care Act wasn't necessarily designed for people living just above federal poverty. It wasn't designed to do that at all. I think it's about 36 states now have taken the expansion in Medicaid, and Wisconsinites are saying loudly and clearly, bring our money home, because that's our tax money. That's money that we're supposed to get back from the federal government to make sure that we cover people who have a very, very difficult time affording health care right now. So I am asking nicely of the Republican leadership to please reconsider taking the Medicaid expansion. I'm not even going to get into the billions of dollars or $1 billion on top of that we stand to leverage from the federal government as a result of taking the expansion. Taking the expansion is the right thing to do. It's the compassionate thing to do, and it's giving people a hand up, not a handout. It gives them an opportunity to have health care that they can afford while they continue to work and bettering their economic lot in life. So I would hope that the Republican leadership has a change of heart on this particular issue. I understand it's difficult for somebody who has fully funded taxpayer health care and choices and access to good quality care to not understand what it's like to be poor and living on the edge every single day. So I hope they change their mind. And with that, I'm going to introduce LaTanya Johnson.
Hello, I'm State Senator LaTanya Johnson. And as we heard earlier, 36 states, including some Republican states like Louisiana, Kentucky, and Montana, have expanded Medicaid. Here in Wisconsin, between 76,000 and 82,000 individuals would be covered if we expanded Medicaid. That's a lot of people. For a family of one, 138% of the poverty level is only roughly around $17,200. And for those individuals, having an affordable health care plan makes the world of difference. For 40,000 of those individuals, they don't have any health care at all. So when they are sick, there's no funding for them to go to the doctor. We all know the importance of preventive care. I myself know the importance of having insurance because I was uninsured when I was elected to this office. And for communities like mine, where the health disparities are already significantly less for low-income families and impoverished families, making sure that they have access to quality, affordable health care is at the very root basis of making sure that these individuals can close the disparities among the individuals who live in the heart of the inner city and those individuals that live on the east side of Milwaukee. It shouldn't matter what your zip code is or your financial status. Health care is a right. It should be a right. The ability to see a doctor when you're ailing or when something is wrong or when your children are sick, it should just be a right. The governor's proposal would have brought an additional $1.6 billion to this state, with a savings of $324 million by expanding Medicaid, having some of those funds matched. We can't continue to walk away from this type of money and continue to foot the bill and not cover all of those that are in need, especially our low-income and impoverished families. Now I'll turn it over to Representative Chris Taylor.
Hello, everybody. I'm State Representative Chris Taylor, and last Friday I spent most of the afternoon in the ER and really drove home the importance and how grateful I am to have health care access to deal with a broken finger. The Budget Committee just finished up 4 public hearings. They were held all over the state. The people who came, they weren't hand-selected. They weren't, personally invited. They showed up because they were members of the public participating in our democracy, and they felt very strongly. Most of the people who showed up felt very, very strongly that this budget, the people's budget proposed by Governor Evers, must be passed. One of the top issues we heard about was Medicaid expansion. One of the top issues we heard about was how we need to make more investments in behavioral and mental health. We need to make investments in personal care workers. We have a shortage. We have a workforce shortage. We need to make more investments in dementia care because we have an aging population. We need to address the child lead poisoning crisis. So those are the concerns that we heard. And it seems like, once again, we have our Republican colleagues who are not listening to the people of this state. I've watched this over the last 8 years. I've watched my Republican colleagues ignore the voice of the people and the will of the people. And it seems like, once again, they have cotton balls in their ears. They have their fingers in their ears. They are not listening. It's hard to believe that you could have politicians against covering 82,000 people, additional 82,000 people under Medicaid, and actually draw $1.6 billion of federal money, which is our money. That's money we paid in taxes. That's money that we want back in our state. Wisconsin is already at the bottom of the barrel for attracting federal dollars. We're 37th in the nation for attracting federal dollars. We don't do a good job of it. This helps us attract those needed federal dollars while saving state GPR money. And these are numbers from the Fiscal Bureau. We're not making these numbers up. And they estimate the state savings just over the next 2 years is $324.5 million in state GPR savings. What Governor Evers does with that savings is reinvested in health care for individuals, not just people on Medicaid, but reinvested in programs that people came out and testified at our public hearings in support of, that are begging us to make additional investments. Counties are begging us to help them with crisis intervention services. We heard about the opioid crisis. We need more addiction services. Those are all the investments that are made in this budget, and that Medicaid expansion, these additional dollars, allow us to make. Without Medicaid expansion, it is going to be hard to meet the healthcare needs that people came out and really implored us to meet. Now, I want to kind of point out this chart right here. We got some numbers from the Department of Health Services by county about what kind of investment this Medicaid expansion and really the DHS proposal is making in different counties. And what this indicates is the investment that's being made in the counties that are represented by various members of the Joint Finance Committee. We want you all to go ask these senators and these representatives, what are they going to tell the people in their state when they turn down, millions of dollars in investment in people, in their communities? What are they going to say? It is not too late to change course. And our call is to the public right now to please help us engage with your senators and your representatives. Make those phone calls now. We are not going to give up on this. We do believe this proposal is so critical to this budget. We know the people support this. We had a Marquette poll just a few weeks ago that said, 70% of people support Medicaid expansion. 70% of people support Medicaid expansion. I would implore my Republican colleagues to not follow Robin Vos off a cliff, because it seems that it is the Speaker in the Assembly that is so dead set against providing health care to people. He has tweeted out in response to an article that even talked about compromise, that there might be some Republicans willing to compromise. He has tweeted out #never. That is not leadership. That is not what his constituents are asking for. We need the public's help in rising up. We have until next Thursday when we're supposed to take up this motion. And by the way, how emblematic is it that the very first motion Republicans are doing is to deny people health care coverage? That says it all. That is not acceptable. That is not what the people of this state want. And it is imperative that we make our voices heard, that we stand with the people, and we're asking, the people to get involved, just like all those people who came out for our hearings, the hundreds of people who came out, the hundreds of people who implored us to act, to help them. It is imperative that we all raise our voices right now and try to stop this very misguided effort that once again sacrifices the priorities of the people to politics. Thank you, and we're happy to answer
Questions?
any questions.
So you just now, and the governor this morning, made this attempt to get the public engaged in calling in their voters. What's your goal? How many calls do you want to be made? What do you think it would take to get them to change their mind? Because Republican leadership has been dead set against this since the minute the governor introduced it.
So, as many as possible is my answer. I mean, when I get 10 phone calls on an issue, it certainly causes me to take notice. But, this should not be a partisan issue. And we know it's not, because we heard from people all over the state. And these hearings were in places we didn't pick. Republicans picked these places. So, as many people as possible, we need to take action again. We need them to make the calls. We need them to demand that they be listened to, that their voice be the priority of these Republican politicians, not the politics that has so dominated this issue. There's so many other states, that are Republican-controlled states, that have recognized that this Medicaid expansion is so critically important to their state, that they have gotten over the politics and they put the people of their state first. That's all we're asking for. That's not too much to ask for. That's what we should be doing here in this building. So we are calling on the public to mobilize. We do know that there is support by some Republicans for this proposal. It does seem like the speaker has really drawn a line in the sand, but we're not going to stop on this.
You need $5 million to stop this in finance. Obviously, all 4 Democrats are
Right.
So who are you talking about? Who are the ones that-
Well, look at this money that they stand to lose.
Well,
Look at,
Things favorable this way.
right.
Who's one vote?
Here they are.
Where do you get the other four?
Here's the targets.
So John Ivan is one of your targets?
Absolutely. We had a hearing in his area, and people turned out. In fact, I think that was one of our best attended hearings of people coming out in support of this budget.
Has he ever said anything that would make you think that there's a remote possibility that he'd go for this?
I think he's been certainly a lot less vocal in opposing than the speaker. The speaker certainly has been the most vocal.
Here's the deal with John. He's got a responsibility with Alberta to put a budget together that reflects the priorities of their caucus. And Medicaid expansion, I think if you talk to some of the members individually within their caucus, they would support the Medicaid expansion because they understand the positive impact it would have on their district. The 70% of the people who support this in polling comes from all over the state. It's not just Dane County. It's every single county within the state of Wisconsin. And so if it does come out, I'm holding out hope that that doesn't mean it can't be reinserted along the negotiation process with the governor's office. But as Chris talked about, starting the very first motion we're going to be dealing with it's going to be this omnibus motion, in part to take out the Medicaid expansion, is a step in the very wrong direction. and will make us have to redouble our efforts and point out to the fact that whether you like the Medicaid expansion or not, the people of Wisconsin support this.
And I think it's important that we realize too that this is not only the right thing to do, it's the humane thing to do. Sometimes I think that as electeds, we are behind these walls just a little too much. And we become disjointed from what the people in our communities want. It's not about making sure that as electeds we follow the will of our caucus. It's about making sure that we follow the will of the people who send us here to take these votes. And, you know, the very fact that we are unwilling to expand Medicaid, especially for an individual who makes $17,200 a month. When those individuals who are not insured go to the hospitals are taking that cost on for all of our uninsureds. And then those costs are then passed on to us. You know, it's being in this body is a privilege. I consider myself to be lucky every day. But I know that there are thousands of people in my district who are not as lucky. They struggle with how they're going to feed themselves, how they're going to clothe their kids, pay their rent. And insult to injury, if you're only making $17,000 a year, now you have to worry about how you're going to pay for health care. I don't think that there's anybody in this building who thinks $17,000 is a lot of money. It's not. So why would we feel comfortable asking those individuals to pay for their medical care? We make $50,000 here, $50,000 a year. And that's not a whole lot of money, but it's significantly more than those individuals who are living from paycheck to paycheck. And to expect us as legislators to come here and to do our job and to care about those individuals, to care about this budget, I don't think that that's asking too much.
Yeah. And the other thing about John Nygren is he does support some of the individual programs that are funded by Medicaid expansion, like the Hub and Spoke addiction treatment program that's funded with Medicaid funds. He has said that out loud. So, you know, those are the kinds of programs, addiction care, behavioral health. Those are the kind of programs that our Republican colleagues have spoken out in support of, and they're funded through this expansion. That's how we do it. That's how we provide the care.
So this memo, I mean, they say that they're going to remove this from the budget. That's going to happen next week, most likely. What do you guys do then?
Well, there's going to be several steps along the way where we can obviously talk about the Medicaid expansion, financially what it means, the programs that Chris talked about that would be affected positively by taking the expansion. And there'll be a couple of different opportunities to not only vote to try and get it back in the budget, but also work with members of finance who are willing to be open and listen about the positive effects of taking the Medicaid expansion and the positive effects it would have on people when they talk about the idea of those now, you know, they don't want to expand welfare programs. This is an opportunity to help people actually get out of that situation. So we'll see where they are. It's, you know, it doesn't reflect well on Robin Voss and Scott Fitzgerald when they direct their co-chairs of finance to remove the Medicaid expansion on the very first item that we're going to be dealing with next week. But again, I'm holding out hope that the door remains open. And that Governor Evers' door is open to sit down with talk with the Republican leadership about accepting the Medicaid expansion.
Should the governor veto the entire budget if Medicaid expansion is not included?
Governor needs to keep every single option he has open. I hope it wouldn't get to that, because if it got to that, that means the Republicans weren't willing to negotiate on anything. And people sent a message loud and clear last November. You got a Democratic leader in the state of Wisconsin. You have Republican majorities in both houses. The idea is for the Republicans to realize that it's time to work together and don't put Governor Evers in a no-win situation.
What happens if Olson's the only one you guys can get to budge? What do you do then?
Well, we will deal with that situation. I mean, we're going to fight taking Medicaid expansion out of this budget. Right now, we're focused on mobilizing people. When we get up there in joint finance, if this is still the wrong-headed direction that my Republican colleagues are insistent upon, we will fight that. We will fight it with everything we have on the committee.
All right, thanks, guys.